Hi, my name is Andrew Robert. I'm the Director-in-Chief of the County of Simcoe Paramedic Services. Currently, as the COVID crisis evolves, we have changed some of our practices in that we're adding additional staffing with the understanding that our level of activity is expected to increase. We have also undertaken a few steps to reduce the number of lower intensity calls that we would normally go on, such as scheduled patient transportations that are not critical in nature. So we've reduced some of that activity as well. So we're adding staff and reducing the activity that can be reduced without negatively impacting anyone. And we're now also looking at a number of processes related to personal protective equipment, et cetera. So in terms of ensuring we have the right resources in place, we've been looking at bringing on more additional staff. We have part-time staff that we're adding hours to, so we're ensuring that they're going to be available for us when we need them. And we have brought in extra cleaning staff. We've hired some new staff that was already planned for this year. We stayed with that plan to hire them on. They'll be engaged in enhanced cleaning activities of our equipment and our vehicles. And in terms of PPE, personal protective equipment, there's been ongoing efforts, as you've heard, throughout the healthcare sector to look for opportunities to procure supplies. We've getting little dribs and drabs of things that are keeping us going. We are ensuring that we have our staff fit tested on the N95 masks, and that we are keeping daily counts of our supplies to ensure that we do everything we can to make sure we don't run out. We are right now investigating enhanced conservation efforts. We're reviewing opportunities to look at sterilization of used PPE so they can be reused safely and effectively. There's a ton of effort going on to ensure that we are in a position to be able to provide the service that everyone requires of us. We certainly want to be here for our community, and we certainly have to be here for our staff to be safe and ensure they can support our community. So in terms of staff screening, we always, for well over a week, possibly 2 weeks now, have required staff to do active self-screening. The first step is at home, that they ensure that they watch themselves. They keep an eye if they have a new cough or they're not feeling right. If they're feeling okay, they can come into work, and when they come into work, they're faced with a very structured questionnaire that they must answer, and we also take the temperature when they arrive at work. So if there's a temperature or they answer the wrong way in one of the questionnaires, they are evaluated by a supervisor and very potentially sent back home for self-isolation, or evaluated through our infection control process to either remain at work if appropriate. So in terms of tracking our activity on the road, we are keeping track of when we encounter patients that fail the COVID screening test, very similar to the COVID screening test one might encounter when they go on the Ministry of Health website. So they'll ask a number of questions about if they have a new or recurring cough, or a new or worsening cough, if they have an infection or a temperature. So when they ask those questions, we keep track of that. So when we encounter patients that are suspected as COVID patients, we keep that as tracking a contact. If during interaction with one of those patients we have a failure of PPE, perhaps there's the mask gets pulled off or some other failure occurs, we track that as an exposure. And we've had very few exposures. We're very happy to report. So we're tracking all that activity. When we do have patients or our paramedics exposed, we go into a very significant review of their protocol of ensuring they are symptom-free or not. We track their progress. When they are on self-isolation as a result of either that kind of activity or even travel, we touch base with them daily to ensure we're on top of their status. And also we've engaged our peer support team, which is psychological support. So everybody that's off on isolation daily gets a call from the peer support team member just to check in on them and making sure they're in good shape. There's a lot of anxiety in the community. There's a a ton of media. People are paying attention, which is great. There's awareness is rising, but with that awareness is the anxiety. And our staff are not immune to it. Paramedics are, although they're healthcare professionals, they're there for their community. They are not immune to this anxiety in the environment. And so we're just trying our best to support them in every way we can and make sure they know we're doing everything we can to keep them safe. In terms of the public activities, we're actually seeing less calls with respect to milder conditions. The calls we are getting are for more critical patients than average before this COVID crisis occurred. So we're finding people are calling us less for less urgent things, but when we're encountering them, they're more sick than we typically have seen in the past. So people should be calling 911 when they are in emergency. They should not be calling 911 when they just want to know if we think they have COVID. We are not there to assess whether or not their risk is there for COVID. There's a lot of resources in place for that. There's really good websites with interactive COVID screening tools. Telehealth Ontario has got a great resource stood up to help people understand their risk related to COVID and advise them on next steps. Some of those next steps might be stay home, you're stable. If things escalate, then you have to move to the next step. They might also advise, you know what, you're at high risk right now, you should call 911. So engaging telehealth is a great first step. And also the websites of Ontario Health or the Simcoe Muskoka District Health Unit have excellent COVID risk screening activities there. In terms of other things that we would ask the public to do is you know, the number one thing we can do is just to not give this bug a place to live. We need to stay away from each other as much as possible. Physical distancing, 2 meters, 6 feet apart, as the closest we should be getting to people outside of our household. By all means, if you don't have to go out of your household, don't go out of your household. The social distancing is so important to reducing the spread of COVID. Hand hygiene, washing your hands is another incredibly impactful and important piece. We've heard some predictions from Public Health, Ministry of Health, indicating that if we were very, very, very good on the social distancing or the physical distancing and the hand hygiene, we would be certainly reducing the curve significantly by a large degree. So if we are very good on these basic principles, we can make a huge impact. And although people say the paramedics and the healthcare workers are on the front lines of this COVID crisis, I'm going to argue that everyone is on the front lines of this COVID crisis, and everyone has a role to play. And sitting at home is not a passive role, it's an active role. You're deciding to take steps to reduce the potential for COVID transmission. And we applaud anyone who does that, and we wish everyone would do that.